Hi, I'm here with Dr. McNally. She had a breast MRI today, and we're going to talk about how we do a breast MRI. Breast MRI is a little bit different than some of the other MRIs that you may be aware of. It's because the most important thing in breast MRI is the contrast that goes in your arm. We're looking for areas that the contrast goes. The way that we start is we take a few pictures without the contrast to sort of understand what does the breast tissue look like before we put in the contrast, and then we take a bunch of pictures after we put in the contrast to see where does the contrast go. And even more important, how quickly does it go there? So the things that are the most suspicious, the dye, the contrast, will go there right away and wash right back out. That's the pictures that we have here on the top. Those were before we put in the dye. This one over here, we have both before we put in the dye and then after we put in the dye. So you can tell that you're looking at after the dye in these pictures because look, the heart is bright. Any place where the blood goes, that dye is going to go. So it goes into all of the arteries and veins and everything that run through the chest, as well as areas of the breast. And there are some spots and dots on her breast MRI, and you can see them on these pictures as well. Really important that we know which ones are new for her and which ones are old. So we're going to go and look at all of her old studies and make sure that all the little spots and dots, all the places where the contrast went, those are places that it's always gone over time. And we're also going to look at, she's had some biopsies in the past, we're going to make sure that the areas that we've biopsied, which are marked with these little black holes here, these little markers, we're going to make sure that those areas that have been biopsied in the past, those aren't changing, those aren't growing, they're staying exactly the same. And after we've looked at all these pictures, then we're done. It's about 3,000 pictures in a breast MRI. It takes about 10 minutes to read all these different images, and before we even start, we have to go back through the patient's history, look at their mammograms, look at their ultrasounds, look at their biopsies, make sure we understand what they've had done in the past, look at their previous MRIs, and then look at these pictures.